For my teaching topic, I have Tylenol overdose or acetaminophen. So acetaminophen is the most common accidental drug poisoning in children, and a toxic amount is 150 milligrams per kilogram or greater in children. So the clinical manifestations kind of depend on the hour it is following ingestion of the Tylenol, of the toxic amount of Tylenol. So from 0 to 24 hours, you may see nausea, vomiting, sweating, and pallor. From 24 to 72 hours, you may see the patient improve and then may have some right upper quadrant abdominal pain just due to Tylenol is metabolized by the liver, and so it would affect the liver and may cause liver failure. From 72 to 96 hours after ingestion, there's pain in the right upper quadrant, jaundice, vomiting, confusion, stupor, coagulation abnormalities, and sometimes renal failure and pancreatitis. More than 5 days after ingestion, there's either resolution of hepatotoxicity or progresses into multi-organ failure. This can be fatal. So for diagnostic evaluation, you want to get the full story from the family or whoever the overdose is from. If you're unable to, then you just have to do blood work. But if the parent is telling you they watched the child consume this much, then you would kind of know. There is also blood levels for acetaminophen that you can do. It does vary. The blood levels vary depending on the hours after ingestion that you draw the blood. You would also want to check liver enzyme tests, the kidney function, like creatinine, BUN, and look at coagulation tests as well. You may see an ultrasound done to see if there's any inflammation of the liver. For treatment, the antidote of Tylenol is N-acetylcysteine. It's given either IV or orally. If it's given IV, it's given as a continuous infusion. If it's given orally, then there is one loading dose that's typically first given with diluted in fruit juice or soda because it has a really bad odor. And then it's followed by 17 additional doses at different dosages. For the nursing considerations, when the patient first arrives, you want to first and foremost treat the child, assess the victim, check your ABCs, vitals are taken, mental status is assessed. You want to check respiratory and circulatory support. Do they need anything? Do they need to be intubated? From then, you want to identify the poison and prevent poison absorption. But yeah, thanks for listening.